afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to HeartWise Talks, brought to you by Voice of Healthcare in honor of World Heart Day 2024. We present our special series, Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And for this episode, we are thrilled to welcome Dr. Maulik Parekh, head of TAVR Structural Health Program at Sir H.N. Reliance Foundation Hospital. Dr. Parekh is a leading interventional cardiologist with extensive experience in TAVR, having performed over 800 procedures. He has trained internationally and is a key proponent of cutting edge heart interventions across India. We are excited to hear his insights on heart health and latest advancements in cardiology. Welcome to our show, Dr. Parekh.
Thank you, Simran. Thank you for having me over. And it's a great interaction. And I'm ready for the questions that you have.
Great. Even we are very eager to hear your point of view on a few of the questions, which is very important for this to spread awareness on World Heart Day. So, could you briefly explain why heart health awareness is very critical in today's time?
So, heart health awareness has always been critical. More so now because earlier we used to see a lot of cardiology heart issues coming up only in older patients, and that to those living in the urban part of the world. Now, with time, we are seeing populations from rural areas or tier 2, tier 3 cities and much younger people getting affected with a lot of heart issues. That is one part of it. Second part, the awareness for physical activity, gym, marathon, and a lot of other things have increased so dramatically because of social media and the other awareness things. But the heart health awareness has not caught up with that awareness. So a lot of people venture into sports, athletics, competitive games, and marathons and other exercises without knowing their predisposition to the heart issues. And then we see all this horror stories of incidents happening inside the gym or on a marathon track. So now with the current lifestyle, I think it has become even more important, far more than it ever was.
Yeah, and I think you said it right because as we are increasing awareness about gyms, marathon, or any other physical exercise, we have to equally emphasize on heart health, and you said it right. Moving on, you have pioneered in TAVR procedures. So could you explain us what exactly is this and how it benefits patients as compared to traditional heart surgeries?
Okay, so see, a couple of years ago, if you have a heart valve problem, so let's say to put this in perspective, 25% of people who are above the age of 70 years will be suffering from some kind of valvular heart disease or heart valve problem. So that's a huge proportion of patients. Okay. Now all these elderly patients are along with valve problems may also have some other comorbidities. Somebody may have lung issue, somebody may have visual issue, somebody may have other issue. So previously, open heart surgery was a must if you had a heart valve narrowing or heart valve leakage. And these elderly patients who suffer from this problem were at a very high risk of perioperative complications because open heart surgery itself is a big do. But with invent of this minimally invasive percutaneous, by percutaneous I mean keyhole or procedures which are done from a small nick in the skin, keyhole procedures or percutaneous procedures, we replace the heart valve under local anesthesia without any cutting or stopping the heart. And entire procedure is over in 45 minutes to 1 hour. And patient goes home in less than 48 hours. Patients treated with this procedure as old as 95-year-old or as old as 85-year-old have undergone this procedure with completely being conscious state and gone home in less than 48 hours. Now, this was unimaginable with an open heart surgery where there would be 5 to 6 days of ICU stay, another 3 to 4 days of hospital stay, and recovery of 4 to 6 weeks. So this transcatheter valve replacement or minimally invasive heart valve replacement procedures have changed the landscape of the patients who need a valve replacement or a valve repair procedure and who are old age.
Yeah. And I think as we are, growing, our country is growing medically, we are technologically, we are growing. So these new advancements are really helping shaping the patient's life and how we can, recover from any disease which is happening nowadays. So, yes.
Yeah.
And
So
yeah.
so yes, I mean with advent of time and with time passing by, our and see now healthcare is not unreachable. A lot of people
Yes.
have tier two, tier three cities have access to healthcare. So people are living longer. And when they live longer, these problems are gonna come.
Yes, you said it right. And what role does early diagnosis play in preventing heart disease, and how can an individual better understand the risk factors? As you just mentioned in the previous question, that we are emphasizing on exercises, gyms, marathon, and all, but they're really not aware about their heart health and how they can prevent any mishap in future.
So see, let me put it in perspective. We have all heard about a patient suffering from high blood pressure, or an office colleague, or our parents or uncles. Now, high blood pressure or persistently high blood pressure exposes you to the risk of heart attack, stroke, kidney damage, and eye damage, to say the least. But the problem is 50% of patients who have high blood pressure have zero symptoms. So, if you are not going for regular checkups, you will never know that you are suffering from this problem.
Yes.
Similarly, similarly, high cholesterol. It runs in blood, it runs in genes. It is very, very common in people with sedentary lifestyle and bad eating habits, which is again rampant in urban population. But if you don't check, you will never know. So I think early diagnosis is the key to reducing the cost and incidence of heart disease and the treatment that we have to do. If you prevent something from happening, you are preventing a major, major catastrophe that may affect a healthy, young, and earning class of the family, or earning member of the family.
And I think that is why we are doing this podcast and this interaction to raise as much as awareness we can through these short talks, small talks, and spread our message across all our audience that they have to be very cautious about their heart health because of the lifestyle they are doing having. So we're talking about lifestyle. So any changes do you recommend for people to maintain a heart health and avoid severe heart conditions? Because we are seeing a very heart attacks at very young age. So how can we prevent that?
Yeah. So see, there are very well defined risk factors which kind of predispose an individual for heart or brain strokes and other blood vessel related disorders. They are called atherosclerotic cardiovascular disorder. Heart attack, brain stroke, they are all part of the same common drum. Now, there are risk factors which are non-modifiable. That means you can't change it. Like family history. If your parents have heart disease in their early 40s or 50s, you are twice or three times more likely to get it. Now, but you can't change your parents, right? So that is something which is non-modifiable risk factor. But there are so many modifiable risk factors. One, avoiding smoking. Two, with regular checks, picking up and treating diabetes and cholesterol problems early. Three, doing regular exercises in terms of some kind of aerobic exercise, 45 minutes a day, 5 days a week. And this does not mean you have to hire a trainer or go to a gym. Even a brisk walk or a swim or a cycling, these are all aerobic exercises. Four, maintain an ideal body weight. If you're overweight, you need to lose weight. And last but not the least is social interaction, yoga, meditation, and social interaction or time spent with family, friends, and nature. They all have proven to be beneficial in reducing stress and reducing the incidence of heart diseases.
And do you think that the stress you just mentioned about spending time with your family and friends is one of the major reasons in today's time?
There is a study. a huge study which has delineated that people who have lived amongst families and friends who have had a very active social life live longer. Okay, so this just says everything. You need to spend time with friends, family, and nature. Take small breaks, take holidays where you are away from your regular lifestyle, day to day work life. It is extremely important and extremely, very less spoken or stressed about.
And I think this is one of the very important takeaways from this podcast, because people are so indulged in their work, in their job and everything. They are so too much involved in their routine that even if they take 2 days, 1 day off, everything is going in their head. The work, okay, what is happening behind me, and everything. So this is very important that they have to take this break for their mental stress and heart health and everything, because this will balance all of these
Correct.
things.
Because see, if I'm at work, if you are at work, if everybody is at work you can't say, okay, I will not take this job. At work you have to do what you have to do. So
Yes.
taking breaks is important.
Thank you so much for emphasizing on that. And moving on, how are advancements in cardiology like TAVR and other non-invasive procedures shaping the future of heart disease treatment in our country?
So uh, we spoke about transcatheter valve replacement or TAVR or TAVI, whatever you call it, is a procedure which has changed the game. Along with that, we have many other advanced treatment options like complex blockages can be dealt with advanced technology and imaging, and with very very precise results, very very good outcomes with stents, or sometimes even without stents, with just some other plaque, or the blockage is called plaque in medical language, plaque modifying techniques, where you don't need a stent. And I'm not saying stents are bad. I'm saying there are blockages which may not need stents. There are blockages which may need stents. So this is very important, and that is where the latest advancements come in.
Thank you for explaining that to us. Finally, I would request if you can share a strong message to all our listeners out there, to all individuals, regarding how can they take control of their heart health and live a healthy, happy life.
Okay, so I think what I said about modifying risk factor sums it all. But if I had to say it in like maybe two lines, I would say regular checkups beyond the age of 35, because otherwise you will not know what problems you already have. We call them regular preventive checkups. They are called preventive for a reason. Yeah.
Yes.
And and taking care of exercise, diet, and leading a good, active social life. These are the important take homes that one can do to kind of prevent or even delay the progression of heart disease.
Thank you so much for summing up this to us and to all our audience. And your all insights, expertise matters a lot to create awareness for the heart health to amongst our listeners. And because we all aim for a happy, healthy future of our country. And thank you so much for participating in that. It means a lot.
Thank you. Thank you once again for having me, and thank you for the wonderful interaction.
Thanks a lot.